Good day, everyone. I'm Elena Vovk, and I will be speaking about the key strategic targets and goals that the global NTB strategy are proposing to implement and the implications for the HIV response. The overall vision of the NTB strategy is a world free of TB, zero deaths, disease, and suffering. By 2035, we need to assure that there is 95% reduction in TB deaths, 90% reduction in incidence rate, and working together, we should always keep in mind the core principles of equity, human rights, community engagement, and assure a governmental stewardship. There are three core pillars of action. One is integrated patient-centered care and prevention. Second is bold policies and supportive systems. And third one is intensified research and innovation. When we talk about TB HIV services, Pillar 1 basically focuses mostly on that. But at the same time, this critical integration is addressed across all pillars. The HIV-associated TB is addressed in the NTB strategy basically because TB is the leading cause of death among people living with HIV. Ending the global AIDS epidemic is simply impossible without our systematic efforts towards ending TB among people living with HIV. And we all need to remember that there are core interventions that we should assure in countries. It is routine HIV testing for all those diagnosed with TB, systematic TB screening among people living with HIV, and we all need to try in our countries to scale up better early antiretroviral treatment, cotrimoxazole preventive treatment, and TB preventive treatment. And always think about how do we create those environments to promote the integrated services so that the patients can come to us and receive all needed care without going to different clinics every single time. This is also in line with person-centered care and TB HIV services, especially when they are needed in combination to be offered at primary care levels. They should be person-centered. There are certain actions that are being required and are proven to produce better impact. The high impact actions are always related to the person-centered care approach. Universal HIV testing for all TB patients should be assured. We need to rapidly deploy and supply all needed molecular diagnostics to the points of care and assure that there are innovations to develop more advanced tools. We need to know and also implement a differentiated approach, decentralized services, and promote those community-based care models, because this is definitely a way to assure that the community and the patients reach our services and are actually assured and provided with friendly care, user-friendly care. We need to assure that routine TB screening is provided at every HIV clinic visit, and that the rapid antiretroviral treatment and TB preventive treatment is scaled up. Also, global strategic work definitely relies on reducing inequalities and removing barriers. And there are several strategic imperatives to maximize equity. This is access to care. This is the involvement of communities, and this is respecting human rights. When we talk about these principles, we definitely talk access in the context of leveraging universal health coverage and making our services available and accessible at the primary care levels. When we engage communities, we need to make sure that we have the enabling environment and social protection frameworks for them to come to us, and also for the systems to make sure that they can reach the communities and they can offer the services in the communities. When we talk about human rights, we need to work on eliminating stigma, discrimination across the entire health systems. And in this work, we definitely need to make sure that we work with the vulnerable populations. We have a focus on key populations, migrants, and people in prison settings. And when we plan our work in the health system, we need to implement fully integrated TB HIV services, but also make sure that we think about how to finance these services in the context of the national scale-up. Now, one important part of the global strategic approach is research, data, and innovation. We simply cannot drive the good TB HIV response if we do not do a good surveillance, collect more robust data, and empower and strengthen innovation. And in this context, integrated TB HIV epidemiological surveillance is very important, so that we capture good data for TB, good data for HIV, but we also make sure that we have everything in place in the systems to check for quality this data and to make sure that we work across services to check for discrepancies and eliminate any problems in our surveillance and assure that the data are robust and are helping us to take decisions. So use data in decision making. The community-led monitoring and reporting is a very important part of research, because only if we encourage and take into consideration the findings from the community, we will be able to tailor these programs to the needed, response at national levels. We need to empower more development of innovative novel diagnostics and their implementation, and see how they work on sites, pilot them, but also see how we can institutionalize good practices if the evidence is there to support this practice for a national scale-up. We need to promote and definitely keep into consideration there are shorter treatment regimens that should be offered, because they assure a better access and a better success of prevention. And we definitely need to work and continue working on developing effective vaccines. One of the important parts of research, data, and innovation is also scaling up implementation science and digital health applications. And in this, it is very important to keep in mind of innovations, but also keep in mind of the context. Are we ready to implement certain things? We will be more successful if we know the needs and if we tailor the tools and the digital applications to the needs in the current context. And we definitely need a firm commitment on data-driven decision-making at all program levels, which means data should be robust and used in decision-making in the national context, but also at regional levels and in clinics. Now, WHO is having several strategies. One is NTB strategy, the other one is a global health sector strategy for HIV, hepatitis, and STIs, and there is an additional policy framework that guides collaborative TB HIV activities. But the core message is that there is alignment in between the strategies, specifically unifying the agendas globally. And all of the frameworks are addressing certain patient-centered care approaches, offering us guidance how to prioritize the interventions and offer HIV testing to all people diagnosed with TB, assure that TB screening is done in all the HIV clinics, and early ART and TB preventive treatment is there to actually be ready to offer this complexity of interventions to the patient when they come to your clinic. All the strategies are looking into the bold policies, systems, and equity, trying to guide us to do better joint operational planning, to focus on universal health coverage, and definitely not forgetting the community engagement. And most importantly, related also to the work that we are all doing at regional and sub-regional level, is to intensify research, to make sure that all the pilot projects that we're doing are also documented and in a way assessed for strength of evidence. So we need to gather more strategic information, but also to continue to intensify surveillance, routine surveillance and community-led surveillance, to empower innovations and to promote the operational research on sites. When we talk about NTB strategy and the implications for people living with HIV, we have to remember that there is the goal to end the TB epidemic by 2035, but we also aim to end AIDS as a public health threat by 2030. And there are some fast-track targets that need to be reached. Those 95, 95, 95 for HIV, meaning that we want to assure that there is 95% of people, there are 95% of people that are aware of their status, and of them, 95% are on treatment, and of them, 95% are virally suppressed. This is what we are aiming to do in the clinics. When we talk general, in the national context, we need to assure that of all possible people infected with HIV, we need to assure that 95% of them are aware of the status, 95% of them are on treatment, and 95% of them are virally suppressed. This is very important. And we all hope that we will reach the time when we will have zero discrimination and less new infections in the world. So basically, to conclude, the national priorities towards 2030 to align to global strategies should be focused on several important essentials. And this is enforcing universal HIV testing among all people diagnosed with TB, scaling up and increasing coverage of TB preventive treatment, and offering yearly antiretroviral treatment to those that are in need and diagnosed with HIV. Establish routine TB screening to be done systematically and offered to all people living with HIV with the best tools that we have now, and we have the point-of-care diagnosis and the rapid test that should be used for that, because the strategy allows, the strategy and the current recommendations are allowing to fast confirm the HIV infection and early start ART. And last but not least, we need to keep in mind that if we have siloed and split services for HIV and TB and other infectious diseases in the country, we need to find a way to consolidate them into integrated TB HIV services of good quality and assure monitoring of this quality. The most important in our work is also not to forget that we need to cultivate local community leadership, to strengthen data infrastructure, and to assure sustainable financing. And for that, we need to work between communities and professional associations and the governments that will understand that domestic funding should increase for our successful and high-impact responses. And here you can see the resources that are available at this time. As the pillars, this is the global NTB strategy, the global health sector strategy on HIV, viral hepatitis, and STIs, and the guide for collaborative TB HIV services that is offering also some knowledge and tools for monitoring and evaluation of these collaborative services. I thank you for attention, and I hope we can all work towards higher impact in our countries.